But as soon as we heard that there was some threat of this virus, we actually began to prepare. And we have an emergency plan that we've had in place for several years. We did not anticipate we'd have to use it for a pandemic. But so we got out all of those policies and began refreshing our memories on those things and putting some things into place very early on. As soon as we heard that there was some threat of this virus, we actually began to prepare. And we have an emergency plan that we've had in place for several years. We did not anticipate we'd have to use it for a pandemic. But so we got out all of those policies and began refreshing our memories on those things and putting some things into place very early on. Our hospice house is still open, of course. And so we do still take patients at the hospice house. We just go through some precautions with those patients and with the staff who are caring for them, and then also with any visitor that they might have. We only allow one visitor at a time now. We're serving close to about 1,450 people in total with all of our programs. There's only a few of those that are at our house. Most of them are actually in home care. And so we have had to do extra training and extra precautions with our staff there. We're doing a lot with telemonitoring and telehealth visits. So our staff are not necessarily going into the homes every day, but we do have people who are going into the homes every day. So we've had to train them. I think one of the things that we are very blessed with is that we do have some staff who can pick up some of those routes. We still have 58 routes that we're running. So 58 routes could be multiple people on that route that we're serving meals to. So some of our staff are picking up some of the gaps for that as their duties have changed. And then we still have volunteers who are out there also doing this. One of the things that we've done for our Meals on Wheels clients is just in preparation for the time that maybe we have a lot of folks off sick or we don't have enough volunteers to do the routes, we've actually done what we call shelf-stable meals. So we have some meals that we can take out that would cover several days if we weren't able to get out there to them. So we have about 10,000 of those meals prepared. Go to our website at midlandcare.org and see what other needs we might have, because our goal is to take care of all of these folks to the best of our ability.